Hello, thank you for joining us. Today we're going to be talking with you about what women need to know about heart disease. We're joined by Dr. Dipti Itchhaporia. Dr. Itchhaporia is the Eric and Sheila Sampson Endowed Chair in Cardiovascular Health and the Director of Disease Management for the Jeffrey M. Carlton Heart and Vascular Institute at Hoag. Thank you so much for taking the time to be here with us.
Thank you.
This is such an important conversation, and I want to get right into it with what you think are the biggest misconceptions when it comes to women and heart disease.
Well, I think that women need to recognize that heart disease is their number one killer. That although we're concerned about breast cancer and cancer in general, even if you combine all cancers, heart disease is still in the forefront as being our number one killer.
What is unique to our physiology as women that makes us susceptible to developing heart disease?
Well, I think that women have not only traditional risk factors, which is the high blood pressure and cholesterol and diabetes, but we also have non-traditional risk factors. Women that have had pregnancy-related complications, women that have lupus and rheumatoid arthritis have enhanced risk in terms of developing heart disease.
And let's talk more about that. How do menopause and pregnancy play a part in increasing our risk of developing heart disease?
Well, I don't know that pregnancy necessarily increases our risk. What it does is it really brings to the forefront some of those underlying risk factors.
Yeah, you're finally paying attention to your heart, right?
Well, yes, and I think that pregnancy in itself is a little bit of a stressor. And so when if we develop high blood pressure or cholesterol or diabetes during pregnancy, sort of the gestational hypertension or gestational diabetes, those patients are going to be at long-term higher risk for developing heart disease.
That's important to know, that it goes beyond just the pregnancy and can be an indicator of what's coming later. And speaking of what's coming later, menopause, those hormonal changes are going to impact us.
The hormonal changes, as the estrogen levels go down, our good cholesterols go down, our bad cholesterol goes up. We're at higher risk for developing coronary artery disease or heart disease in general. We tend to get, tend to put on a little bit more weight, more higher risk for developing high blood pressure, high cholesterol. So I think it's a time for us to really pay attention.
What can we do to decrease our risk?
Well, I think we need to pay attention to what are our risk factors. I think we need to make sure we're exercising regularly, at least 30 minutes, 5 days a week. I think we need to really pay attention to our diet. Make sure we're paying attention to sleep, all of the good habits that you've always learned about, but we need to do that. But also just really be paying attention to what those risk factors are.
Let's talk about genetics. How big of a part does that play in developing heart disease?
Well, I mean, I think we can't get away from our genetics, right? So if you have a family member that had heart disease prematurely before the age of 65, we're at slightly higher risk based on that. So then, if anything, we need to double down on all our risk factors if you're in that high risk group.
All right, worst case scenario, let's talk about heart attack signs. How are they different, those symptoms that would develop in women versus men?
Well, traditionally we think about, the elephant sitting on my chest is the big risk factor. But I think we need, as a woman, she needs to understand that she can have shortness of breath, jaw pain, neck pain. All of those other symptoms could potentially be a risk, could be a way that she's saying, I'm having chest pain.
Great information. Dr. Itchhaporia, thank you so much for taking the time to be with us today.
Thank you.
And thank you for watching. We'll see you soon.